Jasmine, thank you again for providing this interview. The first question we like to ask you is, with your experience, what issues have you noticed with implementing electronic medical records?
That's a very good question. One of the major issues that I've experienced is that most healthcare facilities do not select the right electronic medical record. So in essence, it spends a lot more unnecessary time and unnecessary money to reconfigure the system to meet the needs of the healthcare facility. Other issues that I have, become more familiar with is the lack of capability for the electronic medical record system to appropriately interface between interdisciplinary departments. Another issue that was quite common is the database library on the back end, making sure that it substantiates the medical terminologies that are needed to adequately give the clinical picture of the patient in itself. And that comes with time, and sometimes, a lot with dealing with computer software companies, they lack that clinical background knowledge, and that's where I come into play. So that's some of the issues that I have been witness to with implementing electronic medical records.
Very interesting. What benefits can an electronic medical record bring to an organization?
What benefits? Well, there's a number of benefits. First and foremost, one of the most key benefits is the fact that it promotes patient safety. And I'll elaborate a little bit more on that. And that comes along with computer physician order entry or computer provider order entry, which is also known as CPOE. With the implementation of CPOE, it helps to eliminate the transcription errors that are commonly occurring when you're doing paper charting, because the nurse has to interpret what the physician has actually written, or the pharmacist. And in essence, it spends more time having to troubleshoot, because you have to then call that physician and make sure that you're validating that the order is actually what you're reading it to be. So CPOE helps to eliminate a lot of medication errors with the fact that you're not having to decipher what someone has written down by hand. Another benefit, which is common and is actually coming up, is that of remote access. It's a benefit that sells a lot of physicians on using the electronic medical record, because it gives them the capability of being able to access the patient's chart, whether it be in their office or at home, review labs, as well as place orders. So remote access is very big right now. In addition to remote access is the implementation of a patient portal system, which allows the patient to be involved in their plan of care, which is definitely beneficial to help gain compliance from the patient, and also educate the patient on what's needed for them to help themselves, and as well as help their family members. So those are the key benefits.
Very nice. Last question. How can the services you provide help a healthcare facility?
Okay. First off, my background in critical care in nursing is 12 years critical care experience, meaning I've worked in cardiothoracic ICU, medical, surgical ICU, telemetry, med-surg. You name it, I've done it. I've been a traveling nurse for many years, so I'm definitely familiar with a lot of different electronic medical record systems. So therefore, I can effectively communicate to a software company and analyst the needs specifying per unit, because not every unit is the same, so not every unit needs the same applications. Also too, I can help with training. I have a lot of years with training physicians and nurses. Physicians can be a little bit more challenging, because a lot of physicians are non-compliant with using electronic medical record systems. So I do have a lot of experience with training physicians, as well as helping with implementing upgrades, as well as go-lives, and most importantly, reconfiguring an electronic medical record to suit the needs of your healthcare facility.
Very nice. I just want to thank you again, Jasmine, for your time.
Thank you so much.
Thank you very much.
Absolutely.